Hi, this is Dr. Robert Chao reporting for Room Now from ULAR 2021. Today was an action-packed day on psoriatic arthritis. And first, I'd like to share with you some interesting abstracts on psoriatic arthritis and mortality. The first is a oral presentation 0219. And this was a study on the association of psoriatic arthritis with all-cause mortality. And this was a study coming out of Israel that matched 5,275 psoriatic arthritis patients to roughly 21,000 controls. They did find in the baseline characteristics that the psoriatic arthritis group had more comorbidities. About 38% and 39% of the psoriatic arthritis group used conventional DMARDs and biologics, respectively. There were also more smokers in the psoriatic arthritis group. The results showed that the adjusted hazard ratio was only 1.02 with a confidence interval of 0.9 to 1.15. And that the leading causes of death were the same in both groups, with cancer being the first. Unfortunately, they couldn't extrapolate any specific types of cancer in each group. And also, interestingly enough, there is no difference in the ranking of septicemia in each group. The factors that were associated with increased mortality were older age, male sex, lower socioeconomic status, a BMI greater than 30, psoriasis, and hospitalization less than 1 year prior to death. Also, conventional DMARD and biologic use did not increase mortality. So overall, this study showed us that psoriatic arthritis was not associated with an increase in mortality, at least in this group, and that perhaps treating psoriatic arthritis aggressively can decrease mortality. Ironically, right before this talk, there was another talk, a very similar premise with a study in Sweden that did show an increase in mortality. So as you can see that the results of this kind of topic, it does go back and forth. I think for me, with this Israeli study, I'm going to stick with my Mediterranean diet. The second oral presentation was oral presentation 0221. And this was a very interesting topic focusing on the metabolomic profiling for cardiovascular risk for patients with psoriatic arthritis and psoriasis. And this study included 977 patients with a follow-up of roughly 7 years. Out of those patients, eventually 7% developed a cardiovascular event, which were defined as either angina, MI, heart failure, TIA, CVA, a revascularization procedure, or of course, cardiovascular death. The factors that were associated with a decreased risk were HDL and a degree of unsaturation of fatty acids, and also alanine and tyrosine. But the study could not decipher what specific blood levels of each. Factors that were associated with an increased risk were apolipoprotein B, remnant cholesterol, VLDL, triglycerides, and glycoprotein acetyls. The group was then able to use this new data to create a model that was based on age, sex, and the selected metabolites. And they were able to create a model that statistically significantly improved the predictive performance. And I think the study just tells us that we should take a step back from examining the joints and really focus on the overall health, and not to forget that we're ultimately treating the entire patient, even if they have psoriatic arthritis, and not just their joints. So thanks for tuning in for live coverage of ULAR 2021. Please visit Room Now, and feel free to follow me on Twitter at Dr. RBC. Thanks.